The chairman of the Health and Medical Task Force of the Church of Nigeria Anglican Communion, the Right Reverend Samuel Ike, while speaking in an interview with ACNN News Crew on the 2025 summit with the theme, said the program is an avenue to fashion out a roadmap through which all Anglicans and others can have access to affordable and accessible health care.
The theme for the conference is Health Prosperity for All, getting things done rightly. We also have a sub-theme for the summit, which is Holistic Health for All, the integration of faith, medicine, and community action in resilience. And going from last year, which was also when we started the Health Prosperity for All, and being convened by the primates, who is the visionary, we are given mandates of what to achieve. First of all, to draw up a roadmap of health policy for the Church of Nigeria Anglican Communion. We are also asked to assess the impacts of the Church of Nigeria, as well as how the mission of the Church of Nigeria Anglican Communion in compassionate care of the members can be reinvigorated and reach all, and to fashion out a roadmap through which particularly every Anglican and anybody within our areas of operation can have access to affordable and accessible health care. And then to now see if we can conduct this summit annually so we have a progressive implementation and checkpoint.
Speaking further, Bishop Ike highlighted the progress made so far through the activities of the Health Summit.
At the end of last year's summit, we drew up 20-point resolution, which we made available to the primate, the convener, who graciously also cascaded some of them to the standing committee, which was also captured in the resolutions from the standing committee. Then going forward by January this year, at the Bishops and Wives retreat that held in Onitsha, we actually made a presentation to the House of Bishops, Archbishops, and their wives to now clearly tell them what the resolutions from this health summit had been and where and how they can factor in to already begin to see affordable and accessible health care to all their parishioners. And from then, many questions were asked, explanations given. A number of actions had already been let loose. A number of dioceses didn't have even any form of health facility. Some have begun. Health posts, some minimal form of health center in order to cater for the care of their people. By then, this universal health care, especially health insurance, was virtually non-existent among our dioceses. Now efforts have begun. Some dioceses have actually enrolled their parishioners into the federal or state government insurance scheme. And others are in different stages of doing so, developing health insurance agencies, and the word is to go out there and possibly get every one of our bishops, archbishops, mamas, the bishops' wives and archbishops' wives, to find it as a policy to get every member of our dioceses, our churches enrolled. If we do, then it will now be easier to have a health maintenance organization as a health provider owned by the Church of Nigeria and so registered. The pool of those who are already in the insurance scheme will now form the base. And the more the people are, the more likely the premium, the benefit, and how many more people can be covered.